is Christine, and I'll be providing you with your pre-op education today on pneumatic tourniquets. Following the discussion, I will do a brief demonstration on the application of a tourniquet for a total knee replacement. Pneumatic tourniquets are used in over 1 million surgical cases throughout North America yearly. Injuries resulting from pneumatic tourniquets are commonly pressure-related due to excessive inflation time of the pneumatic tourniquet. First, let's discuss what a pneumatic tourniquet is. A pneumatic tourniquet applies pressure to occlude blood vessels or blood supply to a certain limb during surgery. The purpose is to maintain a bloodless field to ensure visualization for the surgeon. 3 parts of the pneumatic tourniquet allow this to work properly: an inflation cuff, connective tubing, and a pressure device. Now let's discuss when a pneumatic tourniquet is clinically indicated. 2 major classifications require the use of a pneumatic tourniquet: orthopedic and podiatry procedures. Orthopedic procedures include total joint replacement, arthroscopies, bone grafts, amputation, and a reduction of fractures. Podiatry cases include hammer toe procedures, bunion corrections, and plantar wart removal. Now that you know when a pneumatic tourniquet is indicated, let's discuss when it is contraindicated. If there is any interruption in the patient's skin integrity at the desired site of the tourniquet, this should not be placed directly on the skin. If a presence of an IV or dialysis shunt is present on the desired site, this is clinically contraindicated. If a patient has a history of any of the following, the surgeon must indicate and evaluate the disease process before applying a tourniquet: sickle cell anemia, diabetes, impaired circulation, hypertension, and open or compound fractures. The pneumatic tourniquet has been placed at the lowest risk category for the Food and Drug Administration. This device can cause nerve, vessel, and tissue injuries, temporary or permanent, due to the incorrect protection of the skin underlying the cuff, incorrect cuff placement, excessive pressure, and prolonged inflation of the cuff. The number 1 most common reported complication is nerve paralysis, followed by deep vein thrombosis, or a common blood clot. Other complications include, but are not limited to, abrasions, blisters, or bruises at the tourniquet site, along with tourniquet pain. In summary, pneumatic tourniquets allow for a bloodless field during surgery, but may contribute to undesired, unintended complications. Each patient must be individually assessed prior to the application of a tourniquet. The patient's age, size, physical and medical conditions determine the outcome for the use of this medical device. Patient safety is always number 1. Now for the demonstration. This patient's medical history does not contraindicate the use of a pneumatic tourniquet. So first, a protective barrier is applied on top of the extremity to where the tourniquet will go. The inflatable cuff is then securely wrapped around the extremity, making sure that the protective barrier covers the inflatable cuff. After secured, the connective tubing is connected to the pressure device. This pressure device delivers and calibrates air at the selected pressure from the surgeon. After this patient is prepped and draped in sterile fashion, the extremity is then exsanguinated with an edge mark. Once the edge mark covers the entire extremity, removing all the blood from the leg, the inflation cuff is then inflated, and then the edge mark tourniquet is then removed. This allows all the blood to escape from the extremity, giving us a bloodless field. Accreditation can be given to AORN for perioperative standards and recommended practices, the 2013 edition. Thank you.